Tell me first about your life before the surgery.
Before surgery, it was pretty miserable. I felt like I was a spectator in my house with my family. They're running around, playing, on the floor playing. They've gotten into my grandson has a scooter, my husband has a scooter, and my daughter skateboards. And we'd go up to a parking lot, and they'd bring me a chair, and it's like I get to sit there and you guys get to have fun, and it's just like this.
How long was it going on?
Probably the worst part was about 2 years.
2 years. 1 to 10, how bad was the pain?
Without pain medication, it was about a 9.5.
9.5. Now, part of the pain was going down the leg.
Yeah.
Show me where exactly.
Yeah, it would actually go kind of down the sides, and it would hurt a lot by my knees, and then it would even, on really bad days, it would go down to my feet.
Yeah, we call that L4 and L5 radiculopathy, which is a typical sign of the second disc from below being in problem. And this is exactly what we did. So you weren't a medical mystery. We knew what the problem was. It wasn't in your head, it was in your back.
Every doctor I went to, they were like, well, you're young. Just walk it off.
Just walk it off.
Right. And I'm like,
could you walk it off?
I can't walk it off. I got to the point where I was like, yay me,
Yeah.
I put on my pants today.
Isn't it interesting that people do not have the pain themselves?
Yeah.
Dismiss it and say, just walk it off.
Can't be that bad.
Yeah. Yeah,
It's
I
like,
think
you
one of
know-
my blessings is that I have myself back pain.
Yeah.
I know how it is not to be able to move an inch. I know how it feels. So I think I may have maybe a little more sympathy with my patient than the average surgeon.
Yeah. Yeah.
So they said, just walk it off. It's not
Yeah.
real. It's not that bad. But it was real.
Oh.
We did the
yeah.
surgery. Here, this is the surgery we did. Here, this is the screw we put in. That literally what it did, stabilize your spine. This is the spacer we put in. And they're all perfect. And this is the record of the surgery. Our surgery was 28 minutes from skin to skin and 26 cc of blood loss, not even an ounce, 1/10 of the cup of coffee. And you did not stay in the hospital or surgery center. How many hours after the surgery did you go home?
I was probably awake maybe 45 minutes before I got in the truck.
Yeah, so about an hour or an hour and a half after the surgery, you went home.
Yeah.
After a fusion surgery with some steri strips and band-aid on your back.
Yeah.
But at first, you told me it was difficult. Tell me, what was difficult?
When I woke up initially, I was in a lot of pain. It felt like my whole back coming around my sides, down my butt even, was just burning. Like
Yeah.
it just radiated just pain and discomfort.
But that is because I put 4 big screws and 1 big spacer in. You
Yeah.
felt that I was there. I really did something. That's what you felt.
Yeah.
Surgical pain. But you still were able to walk within an hour and pretty much go home. Now, the most important question, how is the leg pain that you had before?
The leg pain I had before was really bad. It was...
How is it now?
I don't really have any.
When did it go away? When did that leg pain go away?
Almost right after surgery.
Yeah.
I mean, I drove, well, I didn't drive. We were 2.5 hours away from where I had the surgery, and we drove straight home.
Okay.
And we stopped once, and I got out and I walked around, and even just doing that, I mean, it felt good to get up and walk around, but I didn't have the leg pain.
Good,
Even
good.
just an hour into driving.
How is walking going now?
Great.
So how far can you walk?
I haven't measured it, but I could probably go at least a mile or 2.
And that is just about 2 months after the
Yeah.
surgery? Yeah. Everything is exactly where we expect it to be with this kind of surgery. And I know you did your research. You know that the open old fashioned surgery couldn't deliver anything even close to this. That you
Right.
go home, feed in an hour or two, not even an ounce of blood loss, not even the half an hour surgery. But knowing what you know now, what would you say to people who said walk it off before the surgery? What would you tell them? What do you want them to know?
That they're idiots. That you can't walk it off, but to do the research, find the alternatives, and I kept looking until I just happened to find you.
Well, I'm happy you
And-
found us.
Oh my goodness, so am I. The recovery of at first kind of being helpless. I was totally fine with it. I'm like,
Yeah.
yeah, just. But then, like into my second week, when I took painkillers when I needed to, but I knew I could feel the limitations of my
Yeah.
body, but mentally I was like, I'm an adult.
Yeah.
Why do I need to have help putting on my pants?
Yeah.
I'm an adult. So it was hard mentally getting past that. Okay, yeah, but in the long run, do what your doctor says now. So in the long run, you're good.
Well, your insurance is UCare and they never gave us a problem to do the surgery. Now, some insurance like Health Partner, actually, they say the only kind of surgery you can get is the open old-fashioned surgery. If your insurance would give you a trouble, say, nope, not after knowing what you know now. If they would say, we don't pay for a surgery that have a small holes and minimal invasive, we only pay for a surgery which massacres your back. What would you tell them?
I would just keep on them until. Let me tell you, I have a talent for pissing people off,
Good for you.
and I would just keep on them. Like, no, you need to
Look into
just
that.
resubmitting all the information I could,
Yeah.
all the studies I could, all the.
Thanks God UCare didn't give us a problem.
I'm
Well,
so thankful.
Well, thank you so much for the interview. I think that's important for people in your situation to know their options.
Yeah. And okay, so my mother-in-law actually had surgery through you. She had the same surgery. I don't know if there were more levels to it or not. But she had an absolute miserable time. But that was self-inflicted.
Yeah, also.
Right after waking up, she decided she was basically crippled. And she laid in bed in a recovery center for a month.
Okay.
And couldn't get up and walk and couldn't lift her arms. And it was, and I think the anesthesia brought out some dementia because for a while there
How old is she?
76.
Okay. Yeah, it's obviously much difficult to recover when you're that age.
Oh yeah.
Yeah.
And she was like, don't do it, do not get it. And I'm like, really? You are ridiculous. You can't see that you didn't get up and move on your own for an entire month and somehow that's your surgeon's fault?
Yeah. Now, when did we do that surgery for her?
Last October.
Okay. Well, how is she doing now?
She's doing a lot better now.
Yeah, she just had a longer recovery.
Yeah.
And so, obviously recovery when you're 70 something is different than recovery when you're
Right.
your age. So,
And she kept trying to tell me, put it off, but I would not tell anybody to put it off, because
actually, I'm happy you talked about that because, everything is statistic in medicine. Not everybody react the same way, but we have a good data. We know that people who are older are going to have longer recovery, and the first month so on is going to be more difficult. We know people who walk right away, you remember I said it's counterintuitive. People who walk right away, they do so much better. If you don't walk first day, second day is going to be much more difficult, not easier to walk.
Oh yeah.
and so on and so forth.
I made sure I got up several times a day, you know, even trying to set an alarm, like, okay, you got to get up and walk.
Yeah.
And I would make laps around my house, just
You know,
even, and
sometimes, you know, I think the difficulty arises that if somebody is like 80-year-old, expect the body behave like a 30-year-old body.
yeah.
That is sometimes, you know, and we talk to people about, you know, you're older, it's going to take longer, these are the steps we need to do. But, you know, we have to do a better job of educating people. We'll
yeah.
work on it. Well, thank you for sharing, especially your mother's story with us. That gives me a reason to go there and do a little more better work and prior to surgery to educate them even more and talk to them how important is that even if it's painful to get out of bed and
Yeah.
keep moving forward. But I'm happy that she's doing much better now.
Yeah, she is. And I did physical therapy. We did 12 weeks of PT getting right up to the surgery, and he was working me on things to do after surgery that aren't big movements, but they help stabilize.
Good.
And I think that helped a tremendous amount.
I'm very thankful for you to give me that feedback as well. It's a teamwork. And that's why it's important before the surgery, we send everybody to physical therapy, and you just nailed it, why it's important. Well, thank you so much for the interview. I really appreciate that. Thanks.